Hi friends, this is Dr. Metabolic. I'm an infectious disease, wound care, and metabolic health obesity medicine certified doctor in Georgia. And I do complex care with the critically sick patients with infections and complex wounds. And obviously, I add and empower my patients for metabolic health improvement. And this is one case example where presenting regarding a patient's perspective, also regarding prosthetic knee joint that we were able to salvage with multi-modality approaches that we take. I don't have much uh, conflict of interest except removing barriers to healing, which is the hashtag I want you to look up if you are interested in many more other presentations. But also, my conflict is nothing but passion to remove barriers for infections, wounds, and obesity. And my hashtag is @woundphysician. And we're working on a telemedicine solution for these problems. This is a nice 68-year-old African American female with history of problems with obesity and arthritis and knee pain. And secondary to problems with obesity, she had uh, weight of around 350 pounds and also had gastric bypass gastric surgery done with banding done in 2018. And she otherwise has been suffering with hypertension, mixed hyperlipidemia, arthritis, and also she had some upper GI bleeding and ended up with uh, venous insufficiency and also significant leg problems with severe knee pain and lipedema changes on the leg. And she ended up having left knee replacement done on 8/30/2023. And patient ended up having a wound that had opened up, and she ended up having um, this area opened up and delayed again at the same time closure done after IND on 9/28/2023 in September. And in October, she had presented to see us in the office because the knee cultures did grow uh, E. coli, and also she needed local care. And her weight on around the date of presentation was 273 pounds with BMI of 49.9. And we ended up doing wound vac and active local care with debridement, exudate management, and infection control, and also added low carb approach and helped her with weight reduction. We did continue and do a standard of care with antibiotic therapy, and this was done for 6 weeks, and also put her on oral antibiotic therapy till November ending 2023. And low dose suppression was given also is secondary to the significant prosthetic knee problem issues that she has until February 7th, 2024. And patient presented to the office on January 10th, 2024, for one of the final visits for prosthetic knee joint infection of antibiotic therapy. Basically, uh, just wanted to show here how her knee progressed. This was the first day of presentation, October 9, 2024. And once the sutures removed, the wound bed opened up, and we did start a wound vac. And if you see here, because of lipedema, the surgical, she needed badly surgery because of osteoarthritis, and they did the surgery. But if you can see here, the edema and the body habitus is caused trouble. And we worked on and slowly applied wound vac, and also the top area closed up sooner. The bottom area took some time, but the total wound healed up in 2 months and 10 days. So as we were doing this, also, as you can see, her weight was 350 pounds and gastric banding done in 2018. Her weight at the time of her presentation on October 18th was 273 pounds with BMI 49.9. And if you can see, we do have a body composition machine, which we did. And also, her weight, if you can see, has come down from the beginning of 273 pounds. And when we started doing the body composition machine in November, her weight was 263 already. And her body composition test that was done on the last visit on February 14th, 2024, her weight was 253 pounds. So there was, 20-pound weight loss. But also, if you can see here, the lean body mass improved from 153 to 158. I don't have the lean body mass because when she presented, because the focus at that visit was infection and wound problems. And also, if you can see here, the skeletal muscle mass increased, and body fat mass, that's more important. You can see the body fat mass went down from 109 to 94.6. And her excess body fat mass came down from 63.3 to 47.2. And the BMI, if you see here, it was 49.9. It is 39.3. And basal metabolic rate also improved. So this is an important finding. And we have to understand the BMR is basal metabolic rate is increasing, not reducing. And obviously, patients, we did basal test, fasting insulin was only 5.9, and hemoglobin A1C was 5.5, but she had high blood pressure issues that are being dealt with the treatments. But the issue, what I want to focus and tell you is people gain, even if the fasting insulin is normal, which is really normal, her possible response to carbohydrate intake is making her good fat storage issues that will help her just in case if there is a famine. But here you can see this whole process has shown significant improvement with her BMR and body fat loss of 14 pounds in less than 2.5 months. And that's an important finding. And she was gracious to give us this interview. And I would like to thank her for this. This is Patient's Perspective.
Thank you for coming. So, tell me about you.
Hey, I've had a knee replacement, was it August 30th? Last year, 2023, 2023. And it was healing good. And so my surgeon, he went back and he took the second valve, but it still wasn't healing like he wanted. So he wanted me to come and see you. And when I came to see you, I came to see you October 9th?
October 18th, yeah.
October 18th, yeah, of the same year. And you did breathing, and we went on the wound back, and antibiotics with the pig line, and from the pig line to the regular oral antibiotics. And so I have, it's healed up.
Yeah. It healed up, and this is February 14, 2024. And tell me what has been your, why do you think you had a wound on your knee? Like, what was that? Like, the surgery was perfect, but the wound did not heal. What do you think might have caused that?
Well, since I've been coming to you, I know now, I guess, I'm sure it must have been something to do with my diet as well. Because it was going to be a
risky surgery
because
of your weight and everything.
Yeah, because of my weight down this way, and
the swelling, swelling and skin folds and all.
Yeah, the skin folds.
So these are high risk surgeries, and sometimes when they do that, there's always a 3 to 5% chance of infection, and particularly when it's on the 8-year person, it could be a lot more than that. But because of arthritis, you have to go in and have it done. So you told me that you had your weight around 350 in 2018, and you had a gastric band done.
Yeah.
You were around 273 pounds in October 18th when you came to see me. So what did we do? We did IV antibiotics. We found bacteria which we did standard wound care, the whole bit. I debrided it and we did the whole bit, we did the wound vac, and we did follow all the standard protocol. And the wound got better, and I kind of brought the things together and things went on to heal. But tell me, what did change about in this whole process of the time that you are being coming all the way from North Atlanta to LaGrange, like what, 2 hours you drive just to see me?
Yeah, an hour and a half almost.
Okay.
But the part about it is coming to a doctor that was real concerned about making sure that you heal. That was number one.
Okay.
And then when the nutrition got involved in it, and I got on board with it to make the changes, the necessary changes. That made a big difference.
Yeah. So, what do you think about nutrition? Was changing your diet help this whole thing? You think?
Yeah, I mean, because I took everything white.
Yeah.
Out of my house. I mean, it's still enough for maybe the caregivers because that's what like I don't use it though. I use more fruit stevia.
Okay.
Or if I want to sweeten my coffee, or if I wanna, and I made a carrot souffle, and they were surprised because it was made with it wasn't made with regular white sugar.
Yeah.
Yeah.
So what did you find the difficulties of this diet, the lifestyle? I don't call it diet. I call it a lifestyle.
Yeah, somebody asked me that the other day. I think my children's father asked me, so how long you gonna be on this diet? I said, it's not a diet. It's a way of life for me now. So was it difficult, this change? Well, anytime you make a change, it doesn't matter if it's diet, if it's nutrition, like even me having to move in a couple of days, it has sent me somewhere in my mind, but it's you make the decision. You know what I'm saying? It's like anything.
In life, that is the only thing that can happen, and that is the only thing that is guaranteed change. Yeah. And we just have to deal with it. Yeah. And let me show you how we effectively improved it. You said that 2018 you had that lap band done, yeah. And when you came to me around 10-18, you were 273 pounds. Okay, mm-hmm. And in between you went to 263, but that was a weight like measurement difference, I guess. But the question is, today you were 253 pounds. This is your bone and muscle. That is your 158 pounds of bone and muscle, but muscle is 84 pounds. You see this? You are like a C. Now we just have a little bit more fat to lose, but when you came in, your total fat mass was 109 pounds. You're 94.6 pounds. So the excess fat was 63 to 47 pounds now. This is the excess fat. So you have come down from 63 pounds of excess fat to 47 pounds. And also, the beauty is your BMI was 41. That BMI is a gross measurement. I don't really like it, but to tell you, it came from 44.4 to 37. So overall, I think this has been an improvement in this. And then, how do you think? What we can, by the way, we do telemedicine, so you don't have to come 1.5 hours. So next visit, since I can trust you that you will do it.
And see, my daughter said that. She said, I think you got to come for accountability.
Yeah.
She said, this ain't got nothing to do with your knee no
more. See, I love looking at it. It's a piece of art.
Yeah.
Okay. But
and even my physical therapist said that. He said, because the other day he put 5-pound weights on my leg, and first we started off with smaller weights. He said, "Oh, you can take 5." He said, "I can't wait to hear what your the doctor said you go Wednesday because I go see him Friday morning." He said, "We had me to do a test." A functional test where I go around for points, and he timed to me. He's like, "You are going up."
So let me ask you one. Can you give an advice to a future patient about the whole thing? What would you advise somebody who wants to listen to your advice regarding this lifestyle change?
I would say get on board with the nutrition because a lot of times we think we're doing the right thing. We've been taught that.
Yeah.
From your parents and maybe even people that are around you.
Yeah.
Because even now when I go out with my friends, I'm sure I influence them. Because like I said, I check the menu before I go there.
Yeah.
To see what am I gonna eat. And so she was like, I'm gonna give you some grits. I said, hey, I'm not eating grits. And I'm not saying I don't desire them, but I don't even know how I would taste it this food.
So what I call it monkey mind to gorillas. The monkey mind is very small,
Yeah.
and every morning it wakes up and it tells you to do stuff.
Yeah.
So what I tell my patients is, don't take the first bite because the monkey mind can become gorilla. So the idea is that we just have to empower community-wise. You need to teach more of your friends. This is not going to happen by one doctor trying to do this. So you need to take this and think about it, learn from it, and teach your family, influence your family, your community.
And the part about it is, that's what I was telling my daughter one day, when you gave me the paper and we went to the car, she took it to her secretary.
Yeah.
Because her secretary got some real bad name problems.
Okay.
And she's young.
We can help her. Send her over here. In fact, we
she-
have a good brain doctor.
She showed it to her, and so she started. She said, Robin is starting to do, not all the way, but she's starting to do some of it that's on the paper.
It's all about process. It's all about process and handholding, and we have all that set up for you. So thank you for taking time. Thank you for
So as you can see here, it's an amazing case, and I would like to thank her again for giving this patient perspective. The take-home points here are metabolic health matters in occurrence of any chronic diseases like osteoarthritis, and obesity plays a major role in surgical complications just because of body habitus, and weight and fat mass reduction via low carb approaches do help in wound healing. This is just one case, but the more cases I see, the more believer I am. And even after gastric banding, without optimal guidance, weight loss will not be sustainable. And prosthetic joints, not all need to be taken out, and some can be salvaged with comprehensive but a multimodality approach. And with a process and technology and a team-based approach, we can do this a lot better. And we need to have a platform-based solution. That is what we deployed for her, wherein we were able to give her a glucometer and a platform-based solution that empowered her to improve. And this is what further a lot more patients will need and healthcare providers will need. Also, we have to understand that every bite of the food that we feed on feeds the disease or prevents it. It's up to us. We should take control of our own health, and we have to make sure that we don't dig our graves with forks and knives. Thank you very much, and thank you for taking time to listen through to the end.